I'm going to be speaking to you today about the translation of work precarity into health problems. I have only disclosures is that I've consulted during the pandemic for Ford, McKesson, Maxim, and UNFI, and this has only been in regards to workplace safety issues with COVID-19. Workplaces are not necessarily the safest environments for us. This is a study done in 2016 that estimated that roughly there are about 120,000 deaths per year that are related to directly the workplace. And this represents about 5 to 8% of the annual healthcare costs. So there is morbidity and mortality to the workplace. The three things I'd like to discuss with you today are in terms of risk factors for morbidity and even mortality in the workplace are the sedentary existence that we have, stress in the workplace, and infectious diseases contracted in the workplace. So let's first start with precarity and a sedentary environment. And this cartoon says, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? So the issues involved in this topic include excessive sitting and health consequences of that, and physical inactivity and the health consequences of that. Those are the two major themes I want to talk about, and then review with you some recommendations. Sedentary doesn't just mean not exercising. Its basic name comes from the Latin sedens, which means sitting. And we know from many studies that sitting excessively has been linked with cardiovascular disease, diabetes mellitus, obesity, even some malignancies and other chronic disorders. The sedentary workplace environments over the last 5 decades have moved really to jobs that don't involve as much standing or even light activity, and they much more are involved with just seating at a workstation. And many of these studies have demonstrated a real link between physical activity and morbidity and premature mortality in sedentary occupations. The classic studies have been done by one of my colleagues at UC Berkeley, Lynn Syme, decades ago, and with bus drivers. And there's also been the famous studies with office-based postal workers. So a clear correlation with certain jobs in a sedentary existence and increased morbidity and mortality. There's also a financial case for a change. This was a study done in the United Kingdom a few years ago that looked at how much loss of working days were associated to sickness. And they estimated that it was about 131 million over a 1-year period of time. The largest contributing factor, about a quarter of all the working days lost, was due to back, neck, and muscle pain from sitting too long. They also found that stress, anxiety, and depression were large contributors, about 12%. And manual occupations had the largest proportion of total hours of sickness. The next highest were office-based administrative, secretarial, sales, or customer service occupations, but both of these were much smaller than the sitting problems associated with back and neck muscle pain. This is just a potpourri of a variety of studies that have been done in the last few years, just to illustrate the points that I've been making. Looking up at the top left-hand corner, with exercise, the risk of death from cardiovascular disease and cancer was markedly decreased in women at high risk of type 2 diabetes mellitus. Breaking up prolonged sitting with just 5-minute bouts of standing or walking reduced after eating glucose levels. They reduced insulin levels and non-esterified fatty acid levels, all positive things. Another study found that prolonged sedentary time was independently associated with a variety of deleterious health outcomes, regardless of the level of physical activity. And that was particularly disturbing because these are people who also exercised, but they had prolonged sitting. Another study found that sitting more than 8 hours a day, people were much less likely to report excellent health overall and poorer quality of life. A further study looked at each additional daily hours spent in sedentary behavior was associated with an increased risk of not being able to carry out daily activities. Another, that women who were sedentary for more than 11 hours a day had about a 12% higher risk of premature death than those women who were less sedentary or for 4 hours a day or less. Another, spending long hours riding in a car every week increased cardiovascular risk. And so this not only related to commuting, but also to people who are in a car or bus for prolonged periods of time, including the manual operators. And another, modest amounts of exercise, averaging about 75 minutes a day, moderate to vigorous exercise activity a week, resulted in 22% less people less likely to die than their sedentary counterparts. This correlated directly with the study up in this left-hand column that I mentioned at first. And finally, avoiding long periods of sitting coupled with even short but frequent sessions of more light intensity movement improved glucose and insulin levels. So these are just a few examples of just a plethora of articles in the literature, primarily in the last 2 decades, that illustrate how important movement is and how this really has come into conflict with our more sedentary existence in the workplace. I want to talk to you a little bit about a study that was published in the British Journal of Sports Medicine in 2015. This was an important study, and they came out with an expert statement on the growing case for change towards better health and productivity. And the focus was on the sedentary office. And I wanted to just give you a couple of recommendations that came from that study. They found that people should really accumulate at least 2 hours a day of standing and light activity, like light walking, during working hours. And eventually, ideally, that should progress to a total of accumulation of about 4 hours a day. So adding movement into our workday, substantial percentage of our workday. And the second general recommendation was that seated-based work should be regularly broken up with standing-based work and vice versa. They argued strongly for sit-stand adjustable desk stations, and static standing postures should by all means be avoided. A few other observations were in that study. One, reduced sedentary practices can reduce the risk of musculoskeletal and cardiovascular disorders. They found that there would be cost savings to both the individual and to the employer by instituting the measures that I just mentioned. And they also observed that about 90% of office workers in Scandinavia now have access to sit-stand workstations, while in the UK that figure was only 1%. Now that was just a very few years ago, so those numbers have improved. Let's turn now to precarity and a stressful environment. And there are a few things I'd like to discuss with you. I'd like to introduce to some of you the idea of allostatic load and its consequences. I want to then talk about physical consequences of stress and focus on both acute and chronic stress. They're not the same. Then just very briefly mention stress, worry, and rumination, and then give some recommendations. The word homeostasis is one I think most of you are familiar with. It really means that it's our body's tendency to always try to remain the same. Yet sometimes that's not realistic and not good. Remaining the same doesn't always allow for successful adaptation. We must change if our environment, our circumstances change. And that change is what we call the allostatic load, and how much of that allostatic load will forces an adaptation. So looking over in the right-hand side, when we're talking about stress, either environmental stresses, major life events, or trauma or abuse, all of these things will lead to increased stress. That is, they disturb the homeostasis. And these perceived, even if they're not real, but in these cases, these would be real, threats result in behavioral changes. Think about if you're startled or frightened about something, we get that fight or flight response where we have a surge of epinephrine that's released, a higher level of cortisol that's released. That leads to a variety of adaptive changes, not on the acute stage, but if these stressors or this increased allostatic load is more chronic, it's going to lead to chronic elevation of epinephrine, chronic elevation of cortisol, and the higher levels of epinephrine cause a higher heart rate, higher blood pressure, for example, change in the release of insulin. Higher levels of cortisol can lead to redistribution of body fat, decrease in the immune response to infectious challenges, decrease of the abilities cells to respond well to insulin. So a variety of things that can occur in this adaptive mode. These are the physiologic responses I'm talking about here. Also, it's important to note that there are individual differences. Some people are genetically more likely or less likely to respond to the stressors. Some people who've developed ways that they can have learned ways that they can respond more effectively to the stressors and not lead to some of these behavioral responses. So what I'm getting at here is that acute stress will have an acute effect, but not a long-term change in our homeostatic relationships with our bodies. Chronic stress will cause a change in our homeostasis. We'll adapt to that chronic stress, and that adaptation may not necessarily be in our best interest. So short-term stress and memory, for example, I have colleagues at UC Berkeley who have done really elegant studies with animals that show that just short-term stressors actually lead to new neurons being developed and resulting in better memories. The classic example is the saber-toothed tiger. In our evolution, those of us who don't respond and remember quickly and remember for long term, the dangers of certain places where the saber-toothed tiger could attack you, those ancestors didn't survive. So those people who really, whose memories would acutely and chronically change had an advantage. Also, worry necessarily isn't always bad as long as it's not chronic. I'll come back to that in a moment. Worry can be a motivator, and it can deepen analytic thinking and planning. There have been repeated studies that have showed that it facilitates problem solving. It can buffer sometimes against negative emotions, and sometimes it helps transmit a desirable set of personality traits. People who worry, some people will be associated with being conscientious, diligent, thinking seriously about problems. So the point I wanted to make with these two issues, short-term stress and worry, they're not necessarily bad when they're not chronic. On the other hand, too much worry can lead to rumination, and too much stress is clearly deleterious. Rumination is the idea that something bad happened in the past and you just can't let go of it. You keep bringing it back and back and back. And that's a negative response to things that are bothering you. So it's just you get into this vicious cycle of more anxiety leads to more worrying and rumination. More rumination leads to feeling anxious, which leads to more worrying and rumination, and more anxiety. So this vicious cycle. And we really need to guard against that. A couple of observations. The 1994 Northridge earthquake in California. There were several studies that looked at people following that earthquake. One showed that the people who survived the earthquake had a steady drop in markers of immune function for up to a year. And another study looked at just under 1,000 people aged 35 to 85, all of whom were working, who perceived the stressful events as more severe and had negative reactions to them. Their heart rate variability was much greater, and increased heart rate variability has been correlated with an increased risk of developing significant cardiac arrhythmias, such as atrial fibrillation. So these were consequences of in the top one of the Northridge earthquake. The bottom study of people of disparate ages all working who had stressful events that were more severe with negative reactions to those. Then there's the classic Whitehall 2 study. This was by Michael Marmot and his associates. I just wanted to review this with you because we've learned an enormous amount from it and several other studies done by Marmot. They looked at people who had adverse health behaviors, too much alcohol, bad eating habits, and so forth. And they found that these folks were at significantly higher risk for having metabolic syndrome being a constellation of high blood pressure, obesity, primarily truncal obesity, abnormal lipids, low LDL, high LDL cholesterol, with a low HDL cholesterol and high cholesterol and triglycerides, and a variety of other things. We know that metabolic syndrome is associated with a higher risk of cardiovascular disease. So these people who had these adverse health behaviors, too much alcohol, et cetera, were at higher risk for cardiovascular disease because of the metabolic syndrome. When they took people who had these adverse health behaviors and they added exposure to work stress onto that, their risk for metabolic syndrome almost doubled. So stress plus bad habits, very bad. But when they added on stress to a group of people that didn't have those adverse health behaviors, too much alcohol, bad eating habits, and so on. So they just added stress onto a group of people without adverse behaviors. The risk was almost the same as people with the adverse behaviors with added stress, which was a remarkable finding, suggesting that stress alone is a major risk factor for metabolic syndrome, which is a major risk factor for cardiovascular disease. When they looked at the major stressor, what they found was that people who didn't have control in their workplace had the greatest adverse effect on their physiology. Another study that also confirmed those findings of Marmot et al. This was a meta-analysis of 288 studies done by Go and his colleagues. And I'm just going to show you one of the conclusions they found where these red arrows are, that all of these are increased odds ratio for mortality. This was stress in the workplace. And what they found was that all of these stressors, secondhand smoke, work-family conflict, long hours, overtime work, no health insurance, all of these increased your odds ratio of increased mortality. But the two that had the greatest impact on mortality were unemployment, which was not surprising at all, and low job control, again, confirming what Marmot found. That is, those workers who felt they had really no control over their work environment had the highest risk of mortality. Other studies I'm summarizing here that were contributors to chronic stress included this following list. I just compiled this from a variety of studies: unwanted or distracted noise, poor air quality, poor or harsh lighting, absence of natural environment, what we call biophilia, workstation configurations that reduce privacy, a lack of control of their environment, lack of restorative or social areas, and individuals under low intensity of office noise exposure. they experienced increased levels of epinephrine. So these were some of the negative working environments that contribute to chronic stress. And some of the positive working environments led to much better health. Visual and physical access to nature was positively correlated with stress reduction. Workers having control over their environmental conditions like thermal, what the temperature was, control over the ventilation, control over lighting, reported fewer complaints about health and stress symptoms. So some of the recommendations from a lot of these studies I've compiled here. First of all, 40 hours is 40 hours. That is, the work week is 40 hours, but if everyone's working 60 hours, then if you're only working 40 hours, it's going to cause increased stress. This is something that we can change. Work with management to gain control, reducing work and unpredictable working hours, for example, encouraging flexible working arrangements, participation in project decisions. All of these can give the person a sense of control. Have an environment with a positive attitude, some of those things that I just mentioned. Have social support. Make sure there are people who can talk to each other and having groups that can meet. Organized exercising in the workplace has been shown to be very helpful. And I would just want to emphasize, utilize healthcare services that are available. Your physician, psychotherapy, just different support systems that your organization may have available, all very helpful. Let's look at precarity and infectious disease now. I want to talk about the chain of infection, that is the transmission of infectious agents and how to break that chain. And specifically, I want to look at the methods of transmission first and then the chain of infections, and then I'll turn to breaking the chain, where I'll talk about attacking the agent, physical controls to break the chain, administrative controls to break the chain, and cultural things that can happen that can break the chain of contagion. This, of course, is a very important topic right now with COVID, but it has been an important topic for years. Influenza is rapidly spread through the workplace, and we know about SARS-CoV-2, the virus that causes COVID, and it's spread in the workplace. So this is the chain of infection. We'll just start up here. We deal with talking about an infectious agent. Let's just use SARS-CoV-2 as an example. The reservoir for SARS-CoV-2 is both humans and mammals, many different mammals, over 21 identified now. But in terms of the workplace, I think we're just talking about humans as the reservoir for this. The portal of exit is almost exclusively through the air, either by large droplets that fall within 6 feet and by very small droplets that can remain in the air for long periods of time, up to 3 hours or even longer, depending upon the ventilation, and can remain in the air for that long. The mode of transmission, as I mentioned, is primarily air. Whether or not inanimate objects is important, we don't think it's very important, but we can't completely rule it out. It's very hard to prove a negative. So some degree of attention to the inanimate objects. And the portal of entry is really just somebody breathing in your air. And the susceptible host is all of us, since none of us at the beginning of the pandemic had immunity to this virus. Now that's changing with both people previously being infected and also with people immunized. And some people are much more susceptible than others. It's important to remember that 3% of the American population are immunocompromised, which is about 9 million people. So in terms of transmission, I already alluded to this, but let me just specify that we started off with the SARS pandemic where we thought droplets, that is 6 feet, was what was critically important. Unfortunately, we learned within the first 6 months that was not the case, that airborne is probably the most important transmission. That is, particles can remain in the air a long time. Contact, either direct or indirect, with the virus. Direct contact would be, for example, you put your hand on an object and indirect contact would be you put your hand on an object where the virus is and you bring your hand to your nose, mouth, or eye and transmit it that way. Direct contact would be within typically about 6 feet of somebody where you'd inhale their droplets when they're doing something as simple as just talking, not even yelling. Ingestion for SARS-CoV-2 does not appear to be important. And of course, fortunately, there's no vector-borne transmission. And ingestion is important in the workplace, though, and I'll come back to that. We don't see, fortunately, much vector-transmitted disease in the workplace, like a mosquito. So attacking the agent is critical and critically important in breaking the cycle. Housekeeping is important in terms of keeping things clean, removing virus from inanimate objects. Again, I don't think this is a terribly important aspect, but we can't rule it out. And so I think that this remains an important tool. And it certainly remains important for transmitting other agents. We know rhinoviruses, the most common virus to cause a cold, do spread by inanimate objects. And of course, Staphylococcus aureus, including MRSA, methicillin-resistant Staph aureus, are important to keep off of inanimate objects that we use because that can spread the bacterium. Hand washing, again, important for other agents of transmission. I haven't had a cold since the COVID pandemic has occurred. And in part because I've been careful about using alcohol on my hands and washing my hands frequently. That's where hand sanitizers become important. And something underutilized is UVC light. UVA and UVB are the deleterious wavelengths of ultraviolet light, but UVC is not. And we can use that to really, as a germicidal of our air. And this can be something that can be would be much more valuable to be used. It's just a nice editorial that was in the New York Times on April 21st by Don Melton. And Don Melton is one of the real world authorities on UV light in terms of germicidal ultraviolet light and safety. Air exchanges are very important. These are the air exchanges per hour. Typically, workplaces have about 2, some have up to 6. Even if you're up to 22 air exchanges per hour, which we never see, hospitals may have up to 12 in isolation rooms. None of these would be sufficient to prevent a super spreading event, but adding germicidal ultraviolet light can really be terribly helpful in preventing and making the air we breathe clean. Very important, I think, for workplaces, and we may be wanting to add that on to much improved air filtration. So let me turn now to some of the physical controls, which include ventilation, that is lots of air exchanges, optimizing that, air filtration with at least a good MERV 13 or 14 filter, or HEPA filtration for air filtration, for making the workplace air safer for us. Just imagine for a moment, or some of you may have seen the old pictures of the old hospital wards in the earlier part of the 20th century. After the great influenza pandemic of 1918 and 1919, hospitals were built and had been built for tuberculosis before that with very high ceilings with clerestory windows so that there was good air circulation. But in more modern buildings, of course, we don't have those real high ceilings and we don't have the windows high up with the good ventilation. And we're really going to need to improve the ventilation we have in our workplaces going forward for dealing with not just SARS-CoV-2, but other viruses that are sure to visit us in the future. Adequate spacing is important, and no-touch engineering is also important, not so much, again, for SARS-CoV-2, but for bacteria like staph and salmonella. Administrative controls are also very important. This is the safety pyramid, and administrative controls really, I think, are underutilized. Optimizing housekeeping immunization policies. We've seen that, of course, in spades with the pandemic. Food storage policies to prevent foodborne outbreaks in the workplace, and testing for transmissible disease before employment. I'm thinking, for example, tuberculosis. And changing the culture is also important. The Family Medical Leave Act, we need to make sure that that's respected. We need to have administrative policies that support people who wake up in the morning with a sore throat or a runny nose and don't make them feel that they have to come to work. As a matter of fact, give them positive feedback for being socially responsible. And of course, society needs to change. I'm thinking of one example right now. I gave a series of lectures a few years ago in Taipei, and I saw so many people walking around outdoors as well as indoors with masks on. Part of the culture for years in many Asian countries has been to wear a mask if you have the slightest hint of a cold. That would be a wonderful culture to adopt here. So thank you very much.
What's the incubation period between chronic stress, chronic sedentary behavior, and chronic exposure to infectious disease before we get the point, oh, we shouldn't be doing that?
Well, I don't have a perfect answer for you. I don't think we understand. I don't think we understand how much is too much. Certainly with infectious diseases, we do, because there we're talking about the transmission of an infectious or contagious agent to another person and they get sick right away. So that's pretty simple, but we can put that aside. It's really, I think what you're getting at is, what about these chronic things that we do? You mentioned sitting, you mentioned stress. Those are the things I talked about in this brief talk. Clearly, short term, these things our bodies easily adapt to them. So I don't think that we have to worry a great deal about, oh my gosh, this last week or this last month I've been sitting much too much. I think the way to look at this is the long run. That these are habits that you want to generate and evolve to. So one of the studies that I mentioned looked at women who were able to increase their work, their mobility while at work, initially just a little bit, but then if they could get up to 4 hours a day, that seemed to be optimal. But that was a process, and the process took months to do, and it may take even longer than that. So that's the way I think all of us should look at this. What the workplace needs to do, the external environment needs to be conducive to allowing us to do these kind of things that we know are salutary. And I think that's where a lot of the work needs to go in. I think if I was given a desk where I could stand up, not only stand up, but that it would be on a treadmill, that I could walk at the same time of doing things, it would take me a while to adapt to that. But once I did, I think my general health over time would be much better.
Good point there. And I think for the sake of our audience who don't know much about ventilation systems, you mentioned that there is kind of a breakthrough in terms of controlling pathogens in the air that's circulated through UVC light. And we know that there are experts around the country who are writing papers on the disinfecting quality of UVC. Can you explain a little bit more about that and how people could, utilize that better, both in their organizations, but perhaps is there any application for a solo worker working remotely?
Right. Well, I think there's two ways that we should be looking at our air. One is, how well is it filtered? By that, I mean, how many pathogens are being removed from the air by the filtration method? Well, actually, I'm going to talk about three ways. A second way is how much air is being exchanged on a regular basis. These numbers that we look at, 8, 10, 12, even more air exchanges per hour. I think that's important, not just from an infectious disease standpoint, but it's also important from a pollution standpoint. By that, I mean that there's more and more data that's been emerging over the last decade, and especially in the last 2 or 3 years, about the risk of pollutants in our air and chronic lung damage. Not just chronic lung damage that's going to lead to decreased vital capacity of your lungs later in life, but also there's been, with the SARS pandemic, we've seen a direct correlation between polluted air and more serious outcome from an infection with SARS-CoV-2, the pathogen, the virus that causes COVID. So I think that you want to look at how well the air is filtered to get out a lot of these things that we don't want to be breathing in, these pollutants that can damage our lungs, and air exchanges can go a long way along with filtration to accomplish that. The UVC light for home use, I wouldn't be terribly concerned about. But I would be very concerned about it in environments where pathogens can transmit. And of course, here I'm thinking about hospitals or other healthcare situations, but not exclusively. There's some industries that really require no pathogens or a minuscule amount of pathogens in their air. So here's a role for not only filtration and lots of air exchanges, but potentially a role for UVC light. What's nice about UVC light is that it can be put just about anywhere. And it's not terribly expensive. It actually reduces energy requirements considerably in buildings. So we have to think about that as well. So I think it's going to be a combination of these things that we should look for in our workplace. In our home environment, I think that making sure that you're cleaning, you're putting in fresh filters on a relatively regular basis, depending upon how much you're using your furnace and air conditioner. Those things can help keep the home environment much safer for you as well.
Great. And I understand that UVC light is put in the ventilation system. Is that right? So it's not a hanging light. It's something that's in the ventilation.
It can be done both ways, but the nice way to do it is in the ventilation system. You get the best of both worlds. Yeah.
So another question I can put to you is about gig work and work where people are specifically driving, app-based gig work like Uber and Lyft and other, kinds of jobs. And it's a common experience for someone who wants to make, money, some profit from being in that kind of work, to be driving 10, 12 hours a day, and sometimes six days a week. What would you say is the likely consequence of having that kind of work?
Yeah, I think the likely consequences in the intermediate term are going to be musculoskeletal. The sitting position is a terrible position for the low back, and the low back is one of the biggest musculoskeletal problems from the workplace. Cardiovascular, related to decreased exercise primarily is very, very deleterious. Redistribution of body fat from lack of exercise predisposes to metabolic syndrome. So all of these things are major issues. There's another thing that often gets missed with gig work. If you're talking about, for example, Uber drivers and Lyft drivers, et cetera. And that is, think of how many people are coming into your car over an 8 or 10 hour period of time. And that means you're getting a lot of exposure. And during the midst of a pandemic that's airborne, there's substantial risk for the driver. It's sort of the same story, for example, with the grocery store clerk, where it's risky for anybody to be indoors right now without a good mask on. But for the grocery store clerk, they're encountering just hundreds and hundreds of people over their work shift. So their risks go way up. So I think these are risks that I think people are paying a lot of attention to for gig workers, particularly in gig workers who are doing these driving for other people.
Right. So one last quick question before we go on to the next speaker, and that is, if you are a remote worker, obviously doing your work from home, do you have any suggestions for how they can minimize the physiological impact or the allostatic load that might cause behavioral changes in a negative direction? How can we minimize that opportunity or that chance of something harming us physically?
Yeah, since March 10th of 2020, I've been doing all of my work from home. I've been fortunate enough to be able to do that. And I've found that it can actually be quite liberating, and liberating from the perspective of conducive to better health. I'm not commuting to the university. I can sit here at my desk like I'm doing now, but I can also stand at my desk. I haven't done this yet, but my daughter has done this. She has a treadmill desk that she's put in, so she's getting a lot of exercise that way. But I discipline myself to get up and move around on a regular basis, so at least a couple times during the hour. And then I make sure I've carved out some time during the day when I choose to be able to exercise, either by walking or jogging outdoors or by an exercise bike I have in the home. What I'm getting at is that I think that we can create a work environment that is actually quite conducive to our health, not just our physical health, but also the emotional health. If I need to take a break from the stress that's going on, I can usually do that pretty well. Some people unfortunately have back-to-back meetings scheduled, and that is a hazard whether you're at home or are at work. But trying to break up the day to decrease the stress can also be extremely helpful. Also, your work hours can expand, so that, not meaning that you have to work more hours, but that you can put the same number of hours into a longer day. So my 8 hours could be broken up a lot more than they perhaps could be at work, where it's more segmented type of life.
Great. So what I'm understanding, and the value of your work, it really comes into understanding, what are the working conditions, what are the exposures, what are the organizational and operational properties of work that can harm you physically, mentally, and physically. And we need to be on guard for a lack of control, exposures, chronic stress, and so on. So we do have some ideas about how to do this, and thank you for sharing those. And I look forward to continuing our conversation in this direction, because it's so valuable, because there are things we can do. Thank you, John.
You're welcome. Thank you very much, Christina. Bye-bye, everybody.